What's up, guys? Dr. Gabrielle Lyon here with my brand new friend, Dr. Cupples. And I want to give you a little bit of background behind how he got here and is now on my YouTube. As you know, actually, I don't know if you guys know this, but a lot of my population actually has sleep apnea, and they're not overweight, super fit individuals with sleep apnea. Almost all my military operators have it. And Dr. Cupples, Dr. Zac Cupples, has a very unique perspective. He's a physical therapist, and I only bring you vetted professionals on here. He is a physical therapist, and one of my patients was saying that they were doing, what was it, jaw, tongue, neck, myofascial training, which you'll have to speak to. And I was just so blown away because one of the things that people think about with fatigue, right, as a physician, and Zac was saying this is, we run a CBC and we look at vitamins, we look at all the other things, hormones, and sleep apnea is a real thing. And then it's not just the sleep apnea, but then it's the subsequent posturing that goes along with it. So Zac, I know we have like 10 minutes, but him and I were talking and I said, listen, brother, can I push you on my YouTube? And he was like, okay.
Yeah, sure. Yeah. And thank you for having me, Dr. Lyon. So basically what we did with this particular patient was, we did something called myofunctional therapy. So myo, tongue function basically is what it is. And so, when you look at something like sleep apnea, or even something like upper airway resistance syndrome, which is basically meaning there's some restriction of your ability to pull in air through your nose. A lot of times that's associated with mouth breathing. And when you mouth breathe, there's a lot of negative effects from that. Namely, you're not getting good pressurization of air through the nose, because there's baroreceptors in your nose that help. When they're stimulated, they increase the diameter of blood vessels. So that drops blood pressure down, etc. The air is also less humidified, and it's your nose has stuff in it that prevents pathogens from coming in. So there's a lot of cons to mouth breathing.
And can you spot a mouth breather? By the way, my husband, Shane, who will watch this video, he literally, and I have videotaped him, he doesn't even know it, breathing through. You see these people, they breathe like they breathe, their positioning is with their mouth open. So like your mouth is closed right now. He's like,
Yes, I see that all the time. And it doesn't even have to be that dramatic. It could just be like a subtle mouth close.
So let me ask you this, is that learned patterning, or is it compensation from something else? Are they doing that because they have a jaw that is, not in its ideal position? Like, why is that happening?
Yeah, so it depends. Long answer, but I'm going to go into what it depends on. So whenever I see something like that, I always ask, like, why would that be useful? And so mouth breathing is useful if you need that strategy for some reason to be able to maximize gas exchange. And so it could be a learned behavior because your tongue has muscles that attach to it that function in various ways. So your tongue is there to basically seal off the mouth, so it will basically pull on the floor of the nose, which is the roof of your mouth. So it maximizes the size of the nose so you can pull more air in. That's one thing. It's also useful for things like chewing. There's got to be placement for that, and swallowing.
Right.
And so if there's anything that prevents you from getting that tongue up to the roof of the mouth during those situations, then the tongue's going to sit low. Your head may change position, and then you're going to breathe through your mouth. But that could be a control thing. So it could be a learned behavior.
Okay. But is that common? And that would probably not be number one. It's more of a compensatory mechanism, right?
Yes, most likely. Because you could also have a situation where you have a tongue tie.
But tongue ties, and everyone has heard about that for infants. If you don't get that addressed as an infant, it still continues on as an adult, right?
Yes, because it's a structural issue. And I think it's about a third of the population has it. I actually had mine released 3 years ago. Yeah.
That's insane, you guys.
Yeah.
I'm totally nerding out with Dr. Cupples. I am sorry, but you guys have to understand, is where I'm coming from is I'm seeing this in clinical practice. And would you say, Zac, that behaviors and compensatory mechanisms like this ultimately result in fatigue? or less than optimal, physiology. And what I mean by physiology, that's kind of nebulous, just more of an energy standpoint, as in being able to oxygenate, being able to appropriately breathe. And then, like you said, pathogens.
Yeah. Well, I think it's definitely a contributing factor. If your
Mm.
sleep isn't optimized, well, that's going to have a lot of negative effects. Like, for example, it's not uncommon for people who have sleep apnea or, again, upper airway resistance
Mm.
syndrome to have several disturbances in a given night, either in deep or REM. And so if you're not getting all of that, that's most certainly going to have an impact on your recovery, mental, cognitive capabilities, tons of stuff. And not only that, but also risk of like stroke and
Totally. And in your practice, do you manipulate for that kind of a thing? Do you address the tongue tie, address the jaw, address just all this upper airway stuff?
So my practice is pretty much, I try to do everything conservative possible. So
Right.
I'm going to address the motor behaviors. If you can't get your tongue up to the roof of your mouth, I'm going to address not just upper airway, but also
So
lower.
cool. That's
Yeah.
so cool. So give me an example of how you would get someone's tongue to the roof of their mouth. Is it
So
practice?
it is, you have to assess where the restriction is in the tongue. So you can have two types of tongue ties, or both. You could have one that's more front of the tongue. Those are the ones that will typically be surgically fixed, because it's like the babies can't lift the tongue up whatsoever.
Okay. So those are the ones that you're typically not going to see that in the adult population. Got it.
Very rare.
Okay.
But there's also posterior restrictions, so one's further back. And so there's tests that you can use to differentiate that.
And what about cheeks?
Those are common as well. Again, a lot of these, if it's severe enough, and if you look at some research by Dr. Sarus Zagi, he's like the guy for tongue ties. He's in Los Angeles with the Breathe Institute. Usually, if you see a restriction that's like 50% or less of maximal range, that's surgical. And so you might have to do those things. There's nothing that I've seen conservatively that could address
Got it.
cheek ties or lip ties, but tongue ties, you can expand the range of motion pretty far.
That's so cool. Zac, I would love to have you back on. If you don't mind. I think that my viewers would really find this interesting, especially because the majority of the stuff that we talk about is really relates to health and nutrition and longevity. And I think the stuff that you're doing is very forward thinking and could benefit a lot of people. Where can they find you?
My website is zaccupples.com, ZACCUPPLES.com. And if you type my name across all social medias.
You guys, I was so impressed with Zac that I looked him up, messaged his office, and was like, dude, you got to get on the phone with me. And that's why I found him. So I will bring more information about Zac here. He's going to come back on. I'm going to drop all the links. I hope you guys like this video. If you like it, subscribe to the channel, and look for Zac in my next newsletter.
Awesome. Look forward to it.